because she's in a bit of a hurry. She's got other commitments. So I just just to give a pointer before you start off, we just wanted to know from a perspective of being a public figure, being somebody who's out and about, who's always in the limelight, keeping to hectic schedules. What does health actually mean for you?
Good evening, everyone. To me, health is basically, it's an everyday process. It's very important that whatever I follow, I'll be able to follow it each and every day, whatever the circumstances may be. If I'm on a diet, I should be on a diet which I can follow under any circumstances. If I'm on a workout regime, I should be able to follow it at least 3 to 4 times in a week. And the skin care, hair care, the regularity is the key.
I understand. So shall I just go across to the panel and take your introductions first?
Yeah.
Yeah, and what you would be talking about today?
I'm Dr. Moon Chopra. I'm a prosthologist by profession, and I will be talking about how to detect early detection of ADs, that is DK, and how we can prevent it, and how it actually affects us systemically if we ignore it.
Good afternoon. Good afternoon, everybody. Is the mic working?
I don't know how to use this one.
Yeah. Thank you, Mr. Mitra. Good afternoon, everybody. So, taking the cue from what Mr. Mitra has already said, I want to elucidate one or two points before I go into my specialty. A medical center, to be very honest, is one of a kind daycare center. Let me tell you. The uniqueness of this center lies in the approach that myself and all my colleagues take to what Payel has told about health. Health is a part of the holistic concept of wellness and happiness. So, if somebody comes with an advanced osteoarthritis, what I am going to speak about today is an alternative treatment of arthritis, which is sustainable, which a person can follow, and which will make them happy and productive to the society as a whole. The common notion is when there is an arthritis, we go for replacement. That is not everybody's cup of tea, both medically, socially, and economically. So we are here as an institution, we are here to make our main motto, aim is to make whoever walks in as a patient, to make them happy. So all the people who are here are works in tandem as a team to make that possible. This is the basic motto and aim of this A Medical Center and what it. And this is how it is a unique concept, a holistic wellness center. This is how, at an affordable cost, this is how we want to contribute to the society. Thank you. Working, cutting.
So good evening everybody, I'm Dr. Shreya Poddar, I'm a consultant dermatologist and cosmetologist at A Medical Center. And I particularly intend to talk about aging and what all we can do to prevent it. And also want to highlight what all we have been doing at our center. It's a one-stop solution for all your dermatology problems, not just aesthetics. We have a great team who caters to everything in clinical dermatology, right from acne, psoriasis, eczema, vitiligo, you name it. We are there for you to treat it. We have all the investigative tools at our disposal. We have biopsy, we have dermoscopy to help make a diagnosis, to monitor your progress. Sir was talking about cutting edge technology. I think we have the best lasers here. We have pigmented lasers, we have lasers for scars, we have lasers for hair reduction, and apart from that, we are well we are very well, doing all anti-aging procedures, right from Botox, fillers, threads, we have HIFU. So I think AM intends to be and is a one-stop solution for all your dermatology and aesthetic problems. And we also work in close coalition with other departments. We have plastic surgeons here. We feel that the case needs to be dealt by a plastic surgeon. We refer it to them and it's taken care of then and there. So yeah, that's how.
Everyone, I'm Dr. Koshiki. I'm practicing fertility for last 15 years. Fertility is growing globally. Apart from global trend, it is West Bengal also. It is 15% of the fertility population is catered by West Bengal all over in the whole country. Fertility issues are in every household. It is in rural, it is in what Obirubda has told, it is a social problem, it is in rural setup, it is in urban setup, it is in socially affordable, socially unaffordable, in all strata of the society is being affected by fertility issues. Now, apart from fertility, the whole spectrum we are dealing in our Boshpukul unit, Koshpa. Today I am going to speak about fertility preservation. It's a new technology. It's a new technology of the old science. The fertility science is for 47 years right now. 78, the first Nobel for the first IVF baby born, and since then IVF is there in the society. But fertility preservation is coming. It's growing its popularity like anything because we can. What Shreya has just told that she can control aging, she can rather defy aging. I also can, in the same way, I also can defy aging in the way I can defy the gametes aging. We will be picking up the eggs in younger years, younger age, and we will be using it in later age when the family is settled, the career is settled, the household is settled, the financial issues are settled, then we can go ahead with the pregnancy. So fertility preservation is a newer trend coming on.
Good afternoon. I'm Somdat Prasad, Dr. Somdat Prasad. I'm an ophthalmologist. So yes, we provide holistic care, but I deal with a small part of it. It's about 1 inch there. But vision, as you know, is a very important sense. There's so many cameras. We walked in and there were 15 cameras. So if you can't see, then you have a problem. And one of the main things I want to talk to you about today is blindness due to diabetic retinopathy. Why did I choose that? I chose that because it is the leading cause of blindness in the working age population across the globe, in all countries but one. So it is very, very important. Blindness in a 90-year-old is bad. But blindness in a 35-year-old working age is really bad. And it can be managed very easily provided people do things regularly, like she said earlier. If you get things checked properly, at times we can deal with it and not let you get there. Even if you get there, we are fully equipped to try and sort out, reasonable kind of vision for you. But the emphasis should be in coordination with the diabetic specialist and getting the diabetic patients to get their eyes screened at time, checked at times, and then we take it from there. The other issues like increasing screen use and strain from that, and some aspects of that, we'll come to that if you have the time. Thank you.
Hello and good evening, everybody. I'm Neeta Day, dietitian and nutritionist. So in today's times, fitness and good health is the new status symbol for the people of age of 40. This is the new status symbol, and as Payel ma'am said, we have to always keep in mind what is consistent, what is simple, only that can be followed. We have made things too complicated with diet and nutrition. There is too much. There's too much everywhere on social media. There are health influencers, coaches. It is too complicated. Like we just had a patient yesterday who has thyroid, who has fatty liver, and who has high BP. Now he has subclinical thyroid, so the doctor hasn't started medication. But he read somewhere on social media that black coffee is good for the liver, so he started consuming. But when you are not taking medication for thyroid and when you have high BP, you cannot take black coffee. So everything is so random and general on social media, whereas it has to be very specific, very pinpointed. It cannot be general and random. So this is causing more harm than good. Okay, so if we see, obesity and lifestyle issues are at its peak now, in spite of so much information. Thank you.
We've got our introduction. We know we've got it all covered. So from the wellness perspective, we've got it all covered. We're starting from the top and we are ending just about the very. So just one more question, Payel, before we probably would have to leave. What essentially do you feel? You've talked about the fact that it has to be regular, it has to be something which can be followed. But apart from that, for somebody who's chasing the clock most of the time, what do you feel are your biggest challenges from I don't know, maybe from your skin perspective or the other hair perspective or something like that, or maybe the diet perspective. Is that a challenge keeping to a diet? Is that a challenge keeping to a workout regime? If that is so, how do you handle that?
I think see, the biggest challenge is the time management. That is the biggest challenge. You have to kind of compartmentalize what you want to do in a day. It's a very day-to-day affair, like you do not have to have a 6 months down the line plan for yourself. Just make one day, as productive as possible. So basically, if you suppose, if I see my schedule is very very erratic. I do not have a 9 to 5 job. It's very uncertain. That's mentally kind of it drains you out at times, because in my kind of work, maybe you are working 2 3 months at a stretch. You do not have a break even a single day. But there are times where maybe you don't work for 2 3 months. You don't work for 6 months. There are people who are like sitting at home. So that is mentally very very upsetting and draining for them. But that is the most important time when you kind of take care of yourself more. Make a proper routine, proper schedule for yourself, so that when you get back to work, that is not a challenge for you. That is very important. And but when like you are again, as you said, that when I'm chasing the clock, I do not have a time. I have to get up at 3 o'clock in the morning, take a bath, sit for the makeup, and go to the shoot. Yeah, that is challenging. That is even more challenging, I guess. But that's physically more draining for me. Maybe I do not have the time to work out. So that time you kind of have to alternate your schedule. Like if you are not having a proper time to work out, just focus on your diet, so that how much you can control your calorie intake, how much you can, how much clean can you eat, like just focus on the vegetables, focus on the proper protein intake, focus on the proper, carbs in moderation, because that is also needed. When you are running all the time, little bit of carb is needed. It's very important. People think that if you just cut off the carbs and just survive on fruits and vegetables and protein, that's going to make you lean. No.
That's what she was mentioning.
Yeah. Again, half knowledge is very, very dangerous. You want to follow proper diet, go to a nutritionist. You want to follow a proper skin and hair care, go to a dermat. You want to have orthopedical problem, go to an orthopedic. So do not see the videos on Instagram and make a choice for yourself. That's the worst choice you can make for yourself. So that's about it.
So true. Thank you. Thank you. So, do you want to start off with what you're talking about? Do you have to leave now? Right. So, so we can start off with your main topic. What you want to talk about? Let's go with it. You want to start?
I want to talk about something which is very, very common to everyone, that is teething. We have encountered in our childhood from a very inception of teeth till it falls off in our mouth. So decay is a problem which is there, which everyone faces. Now, how we can prevent that? Prevention can be done in few things that we have. First, you have to visit to a dentist, and Dentist will tell you how to prevent it. We have different modalities over here. We have different machines to detect. We have like CBCT, which is a very, very specialized machine where it is easy detection is there. So anyone can get it screened thoroughly and go to a dentist, get it rid of it, because when decay is in early detection, then it does not become hazardous and it does not pinch your pocket too. Neglect pinches. So we have scanners over here. We have absolutely different modalities of treatment, high-end treatment. So we have lasers. If a small decay is also there, we can treat with lasers. Root canals are treated with lasers over here. You need not to sit for hours and hours and go through the pain. We do a pain-free treatment over here. So I would request everyone that once in a year, cleaning of your teeth, which is mandatory, get to a dentist, get hold of a dentist and go for a screening and cleaning of teeth, and you will get rid of all the decay and any kind of dental issues. Thank you.
So, how often should someone visit a dentist?
Once in a year, it is mandatory to visit a dentist. So you can get a thorough scaling and cleaning done. Cleaning is required once in a year. Like every day, brushing is required. Once in a year, cleaning is required. Why? Because in any nook and corner, whatever we are eating, the food deposits are there, and it forms something like which is a hard deposit, which is called calculus. So we need to get rid of that. If we do not get rid of that, that is nothing but the deposition of bacteria. If we do not get rid of that, that becomes different kind of diseases, gum diseases, tooth might fall off, or you can encounter decay. So once in a year, scaling is required.
How many times do you brush? When?
Twice you need to brush. I know this is your favorite question. Because twice in a day you need to brush, and once you get up in the morning, if you have brushed at night, then do not brush once you get up in the morning. Just rinse your mouth, eat your breakfast, and then brush your teeth. Because once you eat, all your bacteria comes inside your mouth, and then you have to clean your teeth and get rid of the bacteria. Because once you brush and sleep, your mouth is absolutely free from bacteria.
So, dentists generally are people are scared of, but in this case probably not. And I have been in chairs in here. At a certain point of time, I was too scared to smile here because she would see something which is wrong inside. She finally got me after 6 months, but whatever she did was pain-free. So I can vouch for that.
There is a reason of pain-free, because we have lasers which we are the one of its kind in Eastern India. So we do root canal treatments, we do everything under lasers. So you do not encounter pain at all. And then something we call conscious sedation, that we as a center only we are doing. If a full mouth surgery is there, implants we are placing, we are doing under conscious sedation. It's not full anesthesia, it's just you're halfly sedated. If you people have at any time taken alcohol, you will understand that happy high state. So you all will be in a happy high state, and we'll do the treatment. You'll not even remember what has happened to you.
Can't imagine plucking out teeth and being happy high.
Thank you.
Sir, we'll go to you next.
Even let me.
Arvind, please sit. Please stand.
Happy